Okay.
Catheter-associated urinary tract infections are the number one leading infection that is acquired while a patient is hospitalized. We have three different types of catheters. We have an indwelling urinary catheter. We have an in and out catheter for those who just have urinary retention for the time being and we're trying to relieve the pressure from the bladder. And we also have our common calves that are used for our male patients. Here on this floor, we see mostly the indwelling urinary catheters used, be it that we are a surgical unit. Even if they have a shoulder, a hip, a knee, an ankle, we mostly see the indwelling urinary catheters. Catheters are basically they are known for increasing mortality rates for patients getting urinary tract infections if they're implanted and they stay in over the required amount of time. Any patient 18 years of age or older preoperatively should have a Foley placed but should be removed in 1 to 2 days after surgery. That also helps keep down the infection rate and keep down the patient who does not really need the catheters at that particular time. Acceptable indications for patients to have urinary catheters is if their urinary output is critically ill, if they are managed for retention or obstruction, if they have a neurogenic bladder, or comfort for terminally ill patients such as our hospice patients. We all know that with our colorectal patients, though, that the catheter stays in for however long the surgeon actually specified for them to stay in, be it that it has something to do with the actual gut and the bladder and all that has something associated with it. When placing a Foley, which mostly we do the indwelling catheters, when placing them, there are steps to it. Make sure you use your sterile technique when putting these in. Make sure that you have everything you need as far as the lubricant, the iodine, the hand washing, the sterile gloves, and how to insert them. All the time we don't use those, but we also use the in and outs, and they are also used the exact same way. You just don't leave this one in as far as you leave this one in. Also, methods of preventing, and that's what we're trying to do, prevent urinary tract infections from the catheters. Make sure you use indwelling catheters only when medically necessary. Consider alternatives to indwelling urinary catheters such as female urinals or external catheters if appropriate for men. Properly secure the catheter after insertion to prevent movement in urethral traction. So that piece that is on the edge of the bed, make sure that the Foleys are not kinked and hooked there, and make sure they're draining properly and there's no reinsertion into the bladder from the catheter. Maintain sterile closed drainage system. Use good hand hygiene and catheter urethral interfacing, and make sure that there's no kinks, obstructions, backflow when they're walking. Make sure they're below the level of the waist, and make sure they are all clamped and hooked where they're supposed to be. If there are any questions that you guys may have, I'm willing to answer those questions. This is something that is very imperative to our unit, being that it's a surgical unit. Make sure that you reduce them. Make sure that you promote the aseptic technique when inserting them. Do not threat any asymptomatic bacteria infections because, like I said, catheters lead to the most mortality rate in the hospital. Any questions? Stop it.